عليكم السلام. شلونكم؟ Okay. Shall we start? Okay. Today we'll have a look at muscles of the head and neck. Okay. I will not go through all the details of the muscles of the head and neck. I kept in mind what you have in your book. Your book doesn't give all the details, but at the end I've added a few that you can go as a reference. Okay. Once we have our demonstration, then I'll keep the models as well for the muscles of the head and neck, so we can have a look at them. I do have pictures of the models that we have in the museum. I'll put them together, the relevant ones, and I'll upload them for you at the weekend. Okay, so you can have a look at them as well, and we have to see them, and then I will train you for the OSPI exam, because for the OSPI we will be using models, we will be using pictures. Okay, so I want to make you familiar with the models and the pictures and the way we ask questions in OSPI. Okay. انتوا الحين النتيجة ما نزلوها لا؟ Okay. I want you to focus on yourself. يعني أنا راجعت معاكم the way the exam should conduct. The same way you'll have the MCQ at the end of the term. Okay. Please focus. Don't make mistakes. You're still making mistakes. معناه I revised with you more than 15 questions. Which we sat for 2 sessions, and I went with you through the questions and we discussed what would be the proper answer. مع ذلك I feel that you were not focusing. You need to focus more, because your next final exam will be the same thing. I mean, it will have a percentage of what you have done before the midterm, and then the remaining. So it's almost 70. هالمرة كانوا 50 سؤال. Those will be 75 questions. So you'll have more of anatomy questions as well. Okay, but we need to focus on exact choices. شو الخيارات اللي عندي. You are still making mistakes. I don't want that to happen. We trained ourselves how an MCQs would be, and I told you no 5 choices, I'll give you 4. مع ان الإدارة قالت الدكتور 5. قلت لهم ما بعطيهم 5، بعطيهم 4 مو 5 خيارات. Medical students أعطيهم 5 خيارات، الأصح خيار واحد. Okay, for the medical I don't give them 4, I give them 5. But for you I said no, this is nursing, so let me narrow it to 4 rather than 5. It will be, and I'll try to make it easier for you. ما بيكون عندي بتوهق في 5، اوكي 4 عندي الخيارات. Okay, but I don't want mistakes even in those ones. Okay, so read the questions first and then ask yourself شبي من عندي. زين، بعدين مو انا سيده بقول ايه والله هاي انا عارفه، لا مو بهذه انا عارفه. بقرا الخيارات الاربع، بعدين بسال نفسي على حسب السؤال شنو الاصح. احنا شو يصير؟ نفترض ان رقم 2 انا عارفه بغض النظر حق شنو. ايه هاي انا عارفه. عارفه حق شنو ابي عارفه. Okay, don't make these mistakes. I've seen your papers. وايه هذه انا عارفه. It is not relevant to my question. إيه هذا عرفته خلاص، بس هاي الإجابة. No, Don't do that. And you have made mistakes like that. زين؟ بقرا السؤال الأول، أول شيء الستم شبه من عندي. بشوف الخيارات بقراهم كلهم أربعتهم. بعدين بقول حق نفسي شنو الأصح حق السؤال اللي عندي فوق. مو بنا بجي على الخيارات رقم 2 هاي اثنين عارفانه. Don't do that. Okay? And I've seen answers وانا اخلي نفسي مكانكم والله كأنها اللي جاوب هني كأني يقول بس هذه انا عارفه. زين؟ That is not why I asked. Okay? And it was shocking for me ان انا في اسئله that I've used in your exam the same thing that I discussed with you over here. ما غيرت فيهم بعد. عدل ولا لا؟ I put exactly the same for you as well. حتى التسلسل ما غيرته. زين؟ And then we make mistakes. That should not happen. ترى ما أبي بعدين بقول والله هذه رسبني وهذه كذا. أشوف نفسي. Put a mirror in front of your face. Look at yourself. Where are my mistakes? You have to put the mirror and see it. Okay? ترى هني all the يعني suppose I say well I'm not happy with my marks. زين؟ It's all computerized. هذه أنا بقدم احنا حق طلبة الطب عندنا نفس الشيء. عندنا تظلم المكتب التسجيل يقدمون تظلم ياخذون اعتقد 20 دينار ولا شيء من قبيل هاي. كم؟ 30 ما شاء الله زادوا عليها بعد ها؟ بدوا من 10. اوكي؟ سو ادفع هذه بعدين يصح لي هذه يخليني اطلع ورقتك. اوكي؟ Now when I take your papers out for you it's multiple choice questions marked by the computer. شو اسوي فيه؟ I can't do anything in it. في الفاينل عندي الwritten الOSPI. Because OSPI is handwritten answers, so I'll give you an answer sheet. I put maximum 4 questions with a model or a picture and I'll ask you simple questions on them. زين؟ ما بطلع روحكم فيهم. Very simple ones. And you will write down the answer. هذه هذه أنا أقدر أراجعه. لو كان عندي تظلم بشوفه وراكم. زين؟ أن هل هني في مجال إنه for a mark, half a mark or anything whatever it is. Okay? Otherwise in MCQs if it was just multiple choice I have no choice. عدل لا؟ So yes please.
The OSCE exam the spelling should be 100% correct. The OSCE exam the spelling should be
No. Because look, for the spelling, there are so many students ask me about the spelling. I'm not teaching you English. I'm teaching you anatomy. If you give me the word that makes sense, that gives me the meaning of it, if there is a difference of an A or an E or an O, no, I will not count that. طالما المعنى عندي زين بعطيكم الدرجة عليه ولا بخصم ربع علامة عليها بعد. Okay? So I'm not going to because شوفوا حتى في الكتابة there's a difference between British books and American books. Okay? In A and E الشغلات هذه في فرق شوية. Okay? But as long as you give me that I can understand what you're saying and it fits there, you'll get your mark for it. Okay? I will not punish you because of English. No, I will not do that. Okay? بس انتوا حق المستقبل بيكون افضل لكم انتوا لو راجعتوا نفسكم زين and لان هذه اول مره والاسامي صعبه شويه. So you need to revise and memorize those terms. I told you earlier terminology عندي in medical terminology or anatomical terminology, don't translate it. Please do not translate it. Get the word, open a dictionary or on the website the meaning for it. هذا بيقول لي هاي كذا معناته. زين؟ بفهم معناته ولا بطلع الترجمة مالتها بيعطيني باللغة العربية اسم على هالطول وما بفهم لنا ولا كلمة. Okay? So don't do that. The only place where we teach medicine in Arabic سوريا. زين؟ هناك عندهم الطب العربي. بس لا اقدر اروح اسوي ماجستير ولا اقدر اسوي دكتوراه لان ما عندي في اي دوله ثانيه. So you're stuck with only bachelor's degree. You want to go to a master's PhD, you have to go back to English. اوكي لذا قلت لكم اشتغلوا على اللغه من الحين. انا لو عندي طموح ان بكره ابغى اصير متخصص هالايام nobody sits with a bachelor's degree. I'm telling you. People say, well, let me have a master's or PhD, let me be specialized in an area. Suppose tomorrow he says, well, I want cardiovascular. She says, I want GI. Yes, in nursing there is. There are cardiovascular specialization, there are GIs, there are renal. Okay, you can go for specialities like that. Okay, the next future عندنا nobody will sit on bachelors. Bachelors توظفت أنا بس أنا I'm all everywhere. Okay, so لو عندي طموحات إن أنا بكون حياتي I work for it from now. Okay, let's come back over here. What I've done, I've added some slides for you to look at the muscles of the, this time today we'll have a look at the muscles of the head and neck. Tomorrow we'll look at the muscles of the trunk, muscles of chest, pelvic, abdomen. So we'll look at the remaining muscles. Okay, and then we'll have time to go to the CNS, central nervous system. Okay, our last thing in our this first term is the central nervous system. When you complete the brain and the central nervous system, معناته I look at the autonomic nervous system and peripheral nervous system. بشمل الاثنين. خلصنا منهم بعدين we'll prepare ourselves for our final. Okay. Anytime you feel like to go to the museum, I've given instruction for both the doctors downstairs, Dr. Yunus and Naji. Nursing students will come, accommodate them. Okay, so they'll give you, even if there is a demo, they'll tell you where to sit and they'll give you any model you need. If anybody does not cooperate, come and tell me. Okay, I've given them very clear instructions. I'm in charge of that place, that my nursing students will come anytime they like. Let them, give them the model they need and give them a place to sit. Okay, once you finish, if the model is to be returned to them, return to them. If they tell you just leave it there, leave it there. Okay. If I look over here, I'll look at the muscles of the head and in the neck. So this is a lateral view from a side. We have lateral views, and in X-rays, AP and lateral, anterior, posterior and lateral. أنا عندي anterior posterior AP ولا عندي PA posterior anterior. Okay, هاد term AP يستعمل و anterior posterior و PA posterior anterior. ليش؟ Now when I take a view, anterior posterior means the rays come from the front, go to the tray at the back. So I'm standing like this and the tray is at my back. You would see that we take X-rays like this as well. So you are facing the tray. Okay, posterior anterior. So the rays go from my back to my front. Okay, when the laterals. Why we take two views? Because in many occasions, if there is a fracture, I can't see in one view. If it's a line fracture, أشوفه في اللاترال ما أقدر أشوفه في الAP. So we take both of them, but مثل ما قلت لكم ما فيها والله ما طلعت حلوة بعيدة مرة ثانية. No. X-rays are invasive. Okay, this is radiation. So one view I've taken, the other one, and that's it. ما بعيدة. It should perfect. بعدين تشوفون اللي تاخذون الأشعة اللي بياخذ الأشعة بيطلع برا لا because it's invasive. Okay, the other modalities in radiology are non-invasive. The other كل modalities اللي عندي عدا radiology هذه. Okay, now we'll have a look. This is the lateral. Why we came to it? This is the lateral view, and you can see frontalis over here, you can see the temporalis, then there are muscles over here, orbicularis oculi, okay, orbicularis oris, this is circular, this one is circular, masseter, this one is an important muscle which is sternocleidomastoid, is one of the major muscles of the head and neck. Platysma is over here, is a thin layer over my neck over here. This is the platysma. So we'll look at the platysma and we'll look at the zygomaticus, and both there is a small and the larger one. Buccinator, here muscles, and we'll look at the action. Once I identify them, then I'll look at the action of these muscles, okay? Generally speaking, muscles of facial expression, they originate on the skull. هذه كقاعدة, huh? Okay. Muscles of mastication. Mastication is when you chew the food in your mouth. You masticate the food. Okay. فنسميه mastication. Muscles that masticate or masticate the mouth, they move the mandible. This is my mandible. Okay. Muscles of the tongue, name ends with glossus. احنا الtongue ما عندنا فما اضفت الtongue. Okay. Muscles of the pharynx, the swallowing the pharynx. Okay. Pharynx and the oropharynx, laryngopharynx, and so on. So there are three parts of the pharynx. Okay. And we begin the swallowing over here. Extrinsic muscles of the eye, they originate of the surface of the orbit. Orbit is the round circle, the bony structure of my skull. That's the orbit. They control the position of the eyes. Muscles of the anterior neck, position of the larynx, depress the mandible and tense the floor of the mouth. They support the muscles of the tongue and pharynx. هذه كقاعدة. Okay, so when I look at what's the basic principle for these muscles over here. طيب. Facial expression, orbicularis oris, constricts the mouth opening. Buccinator moves the food across the teeth. In infants, provides suction for nursing. Now, orbicularis oris, here if you look at now, this one what we said, this is the orbicularis oris, and this is the buccinator. Okay. Now I want you to, there are pictures and there are models like that one. First of all, we'll identify these muscles. Which one is orbicularis oris, and you don't mix it up with orbicularis oculi. Okay. Bad dairy, but that one is surrounding the eyeball and this one is the mouth. Okay. Now, the circular muscle orbicularis is also called as the kissing muscle. Okay. In books they also name it as kissing muscle. Okay. It closes the mouth and protrudes the lips. لأن عندي protrusion حق lips, they are also known as the kissing muscle. Okay. So if you read this term even is mentioned in your own book as well. Okay. Now, frontalis, جيت على الفرونتاليس لفوق, it elevates the eyebrows when it gives an upward expression. Okay, draws the scalp forward and wrinkles the skin of the forehead. Okay, just an original insertion for this is of the cranial aponeurosis. Subcutaneous is the skin of the eyebrows. Occipitalis retracts the scalp, fixes gallia politica. There is a aponeurosis on the frontal. Okay, occipital and temporal bone, and the cranial aponeurosis. I want you basically ما أبي الاتاشمنت من عندكم، اللي أبي من عندكم هذا نقرأ أحسن، بس أبي إنه you should be able, if I give you a picture, a model or something like that, رقم واحد, I should be able to identify the given muscle and the action of that muscle. Okay, خلوا في الاعتبار الاشياء الاثنين هذول المهمين. I should be able to identify the proper muscle and then know the action of that muscle. Okay. Now if you look over here, this is the frontalis. So I've added some more pictures for you, so you can see the frontalis over here. This is orbicularis oculi. This is the mouth muscle over here, orbicularis oris, and then the other muscles, the masseter, buccinator, and so on. In an AP view, you can mentalis. I'll talk about the mentalis as well. So we'll look at the muscles and we'll try to identify the muscles of the head and neck. Orbicularis oculi, eyelids, closes eye in blinking, squinting and sleep, aids in flow of tears across the eye. Okay, and this is the origin and the insertion for the muscles. So over here, I look at the orbicularis oculi and I would know the action of that muscle. Right? Orbicularis oris on the mouth, levator labii superioris elevates the upper eyelids, levator anguli oris elevates the angle of the mouth. هذين المسلز اللي عندي هني, you can pick them up from here. Okay, so I want you to see the pictures, see where that muscle is, and then look at the action of that muscle. طيب هذه يحتاج لأن models مثل هذه عندي في المشرحة. Okay, so model of the head and neck, yes we have. Alright, I put some cadaveric as well, بس أبي على الأقل المودلز اللي يكون عندكم واضحين، فبشوف المودلز بتعرف على المسلز اللي موجودين هناك. Okay. Zygomaticus, major and minor. حتى zygomatic, if you know it, this is still fine. They are major and minor. Draws the angle of the mouth upwards. Zygomaticus minor elevates the upper lip. And these are, the original insertions. If you look at over here, this is the zygomaticus, major and minor. Okay, so these are the muscles over here, and look at the first identify the muscles, and then look at briefly what is the action of that muscle. Right? Mentalis and buccinator. Mentalis elevates the lower lips when you drink. Buccinator compresses the cheek against the teeth and gums. This one is very important when there is food in the mouth for the molars retraction. Okay, for buccinator, here if you look at the muscles over here, this is your buccinator. Okay, once you identified it, and then you will see where do I use it. Okay, in the platysma, platysma is superficial muscle بيجي على النك هذه كلها. This is all platysma. That's right. هذه كلها, this is platysma. Draws the lower lips and angle of the mouth downwards in expressions of horror and surprise. So this retracts. من الخوف ولا فاجأت مرة. Okay, there's a retraction over here for this muscle. Okay, this one, this is a superficial muscle. This is the platysma, which is covering all the other muscles. It's a thin muscle. It's not thick. It's thin, and this is your platysma over here. Sternocleidomastoid. Sternocleidomastoid is a very important muscle, so I have to know about it. Okay, sternocleidomastoid you have on both the sides. When you move to the opposite side, you will use one side. شوفوا الحين لو أنا بلف راسي مني, you can feel this muscle. راسي مني, you can feel this muscle. Okay, so sternocleidomastoid could be folded like that, is it? Because that deals with the opposite side. Okay, and here this is your sternocleidomastoid. If you look over here, this is the sternocleidomastoid. Okay, and it's a very thick and prominent muscle. أدلة turn your head on the opposite side, then you can feel it. If I turn like this, feel it here. Turn like this, you will feel it here. Okay. Now this is a cadaveric specimen, and here is your sternocleidomastoid. It comes not only over here. Look at the attachments. هذه clavicle, it has an attachment with the clavicle as well. So this attachment and this one, هذه كلها sternocleidomastoid. I'm not going to ask you at this stage what is the attachment of this muscle. No, I want you to identify the muscle and know the action of that muscle. Okay. هذه لكم انتم هذه ابي هذه. Okay. لان في الترم الثاني راح ندخل في systems in the body. So we'll pick up the respiratory system, cardiovascular system for the heart, GI, renal, reproductive, and so on. طيب. Then we'll نغوص شوية أكثر. حاليا let us be at least be able to identify them. Okay. So focus on, if you see the picture, هذه بيساعدني في حالتين. بيساعدني في الريتن في الام سي كيوز، بيساعدني حق الاوستبي بعد. Once you can identify بيساعدني حق الاوستبي بعد. Okay. Now you look at the muscle, the sternocleidomastoid. Extrinsic muscles of the eyeball. Now I've put, these are recti, muscles of the eyeball. These are not mentioned in detail in your book. Okay. So from here onwards I've put some muscles which are in books of nursing. فانتوا لو حابين تشوفوهم شوفوهم. انا قلت لكم انا عندي قاعده وياكم، اي شيء مو مكتوب عندكم في الكتاب ما بسال عنه. اوكي. ما بجيب شيء في الامتحان مو موجود في سلايداتي بس مو موجود عندكم في الكتاب، ما بجيب. For anything I would put, I'll make sure that it is mentioned in your book. في السلايدات استعمل اشياء اساعدكم على الفهم. اوكي. في شويه اضافات بخليها so I can understand. Okay. But any questions I put over there, it has to be in your book. Okay. Now if I look at these, recti are the muscles of the eyeball, inferior, medial, superior, lateral, and then inferior oblique and superior oblique. This is the eyeball, and these are the muscles. If you look over here, this is obliquely going. This is the superior rectus, here inferior rectus, lateral rectus on the lateral side. So you can feel that the lateral will pull my one eyeball this way. If it contracts, medial rectus will pull it towards my nose inside. Okay. So you can see the action. Now what happens is when you see somebody as a squint, eyeball the central is رايح للداخل مثلا, you would know which muscle is weak. Or it's towards outer side, you put both the eyeballs over there and you see one is slightly lateral, the other one is straight. Again that will indicate to you where the problem lies. Okay. So look at the recti muscles. Here again this is the medial rectus. So medial rectus, when it contracts, it will pull the eyeball inwards. Okay. These are the inferior rectus, and up over here is the superior rectus. These are the muscles, exterior muscles of the eyeball. Here you have them, all of them over here. These are the four that you see, and these are the oblique muscles. From inside, this is your optic nerve. انتوا شفتوا الاوبتيك نيرف، شفتوا الاوبتيك كانال. هذا لا، لأن شفت الاوبتيك كانال ورا في السكال. This is the optic nerve that passes through that canal. Okay. So the innervation comes through the optic nerve over here, and then you have the movement of the eyeball muscles. Mastication, you have the masseter, temporalis, and trigoid muscles. Masseter, temporalis, and trigoid muscles, these deal with mastication, chewing. Okay. Then أنا بخلي أكل شيء. When I chew the food in my mouth, I use muscles of mastication. Okay. This is the temporalis, this is the masseter, this is the zygomatic arch, فبيكون عندي zygomaticus. trigoid muscles, medial and lateral trigoid muscles, okay, and you would identify the skull, anterior neck digastric, mylohyoid and gynohyoid, okay, and the digastric, mylohyoid and gynohyoid, stylohyoid, sternocleidomastoid and omohyoid. These are anterior neck muscles, okay. من هذين كلهم اللي احنا بنركز على مكتوب عندك في الكتاب بعد is sternocleidomastoid because of its supporters. So the most from this list sternocleidomastoid, okay. هذه احنا قلنا if you look over here, this is the sternohyoid and so on. I want you to look at the sternocleidomastoid. It has two heads, clavicular and sternal head, because it has attachments over here. So you look at the sternocleidomastoid, okay, and the action of this muscle. These are gynoglossus, mylohyoid, and so that you would see in pictures. Thank you very much indeed. Okay. هذه ترى على فكرة أبيكم خذوا راحتكم فيهم. حصلتوا وقت روحوا انزلوا المشرحة، خذوا مودلز شوفوهم. في احتمال أول مرة ما أعرفهم كلهم، ما عليه، عرفت نصهم كان بها. Next time I'll see the other ones. Okay. Thank you.
دليل ان في السلايدات محطوطين بس رؤوس اقلام، هل مطلوب على ان احنا
لا شو هني ايه اللي خليتهم في السلايدات؟ ها؟
كانوا بس رؤوس اقلام.
لا هني بتشوفين فوق مو حاطينهم، لا اللي حاطين رؤوس اقلام اوكي جس تعرف علامة رؤوس اقلام.